Hello and welcome to Seven Sentinels. This is Grandmaster class and I am Peter Simon with you. Today we have Dr. Imrah Kirmani from Saudi Arabia, originally from Srinagar, India. Yes. Yeah, note down the points which I am telling you, Dr. Imran, whatever I am telling you. Yeah, your handwriting has differed a lot. Okay, very good, very good. I appreciate your focus and paying attention. Yes. Now, this is Priya Sharma. Yes, Priya Sharma. You can mute your phone, mute your mic, because when I ask you, you can unmute, no problem. Priya Sharma. This is the official case notes. Right. Fine. Yeah. So you're writing a referral letter, remember that. And you're writing to Dr. Smith. And Dr. Lisa Smith is the full name. So this you can eliminate. And an endocrinologist, this is an address. So no need to write an. Then city hospital. Okay. Then new town, 4 lines. Yeah. So 4 lines. Very good. Now you are maintaining the margin. Dr. Lisa Smith, handwriting is good. Endocrinologist. Okay. Then city hospital, new town. Very good. 10th February 2019, you changed the style and you wrote the name of the month because month name is there. For 10, no name. So you have to write the number. 2019, no name. So you have to write as it is number. But this second month has a name called February. So you have written, you have implemented. That's very fine. Dear Dr. Smith, fine. Then regarding Mrs. Priya Sharma, comma, date of birth, colon, 8 May 1958. Awesome. Thank you for seeing Mrs. Priya Sharma, who has type 2 diabetes with elevated blood sugar level. Elevated blood sugar level for further management. Okay, after this paragraph is finished, you are supposed to leave 1 line. Okay, after every paragraph, you have to leave 1 line. That is very important. So here you have left, here you have left, here you have left. Then what made you not to leave here? That is very important. So you are not supposed to do like this. You are supposed to leave a line after every paragraph. That's very important. Okay, now thank you for seeing Mrs. Priya Sharma, who has type 2 diabetes with elevated blood sugar level for further management. Okay, all right. Fine. So now let's go to the case notes. Right. So here it is. Mrs. Priya Sharma is a patient in your general practice who is concerned about her glucose level control. Okay. So 29 December, 5th January, 12th January, 30th January. Okay. Now, so glucose level control. Okay. Then yeah, this is the latest one. High range, other blood sugar 7 to 18. So for further management, so fine, that's good. Right. Is a referral. No, that's fine. Absolutely fine. So here, specialist at a diabetes unit. So you have missed this point. He's a specialist at diabetes unit. This Dr. Lisa Smith is an endocrinologist in the diabetes unit. So the fifth line will come here. Diabetes unit. How can you miss that? Endocrinologist in which department? Diabetes unit. That's, you have missed this point. They may give any point anywhere. You have to identify that point and bring forward. So be careful. Diabetes unit. That is the line there. So Dr. Lisa Smith, endocrinologist, diabetes unit, City Hospital, Newtown. He's not an endocrinologist in city, he's in a department, in a unit. That's it. How come I identified and how come you missed? You could have got some additional points for that, definitely. Right, next one. Thank you for seeing Mrs. Priya Sharma, who has type 2 diabetes with elevated blood sugar level. Where is the word referring? Why are you not referring the patient? Okay. Why are you not referring the patient? Huh? Okay. She is being referred for further management of blood sugar levels or whatever it is. Okay. She is being referred for further management. You would have said like that. So where is the word refer? Referral. This is a letter. How do we know that it is a referral letter? Okay. So how do we know? Okay. She is being referred for further management. So this is the way how you could have written this sentence. You just wrote, thank you for seeing Miss Priya Sharma, who has, thank you for seeing Mrs. Priya Sharma for further management. How does it go together? Okay. So she's being referred for further management, you can say. Otherwise, if you want to write one sentence, you can remove all these things. Why you should thank you? Why you should thank the doctor or the specialist? Why you should thank him? Okay. So why you want to, I thank you means who is thanking? I thank you. That is the meaning. I is understood here. I thank you. That is the meaning here. I is understood. When you say come here, it means you come here. When you say thank you, that means I thank you. So I is understood. Why are you bringing I here in the picture? Is it necessary that you have to say that I? Who is important here? Priya Sharma or I? Priya Sharma or you? Why are you bringing I and why are you bringing you? You are thinking that it is a formality, but this is a formal letter. This is not a friendly letter or personal letter saying thank you. This is a professional letter. We are not requesting somebody to do his duty. It is his duty to do it. It's a profession. It is his obligation, it is his compulsion to do it. It's a formal letter. Whether you thank him or you don't thank him, he has to do it by all means. But why are you bringing I here? Why are you bringing you here? So Priya Sharma is important. Why are you taking the importance of Priya Sharma and throwing it on yourself and on the other person who is? You are not important. He is not important. Priya Sharma is important. Priya Sharma is the subject of the sentence. Give the king its importance. It's an emperor. Give Priya Sharma the importance. Every line is regarding Priya Sharma. Why are you putting your name and the other person's name there in between? It is called undue advantage. Don't give undue advantage in formal letters. If you want 400 plus, if you want 450 plus, forget this normal style of ordinary people. I don't believe you are an ordinary person. And now I am also with you. Okay. You cannot be an ordinary soldier. You are a warrior. You are a commander for me. Okay. I am there for you. So don't use this I, don't use this you as far as possible. Right. You can say directly, you can avoid. This is not wrong. What you have written is correct only. I'm not telling it is wrong. But the quality is very low. Because I is not important. Okay, only you can refer this letter. Anybody can refer. What is the so speciality about you? Only Mr. What's his name? Only Miss Lisa can do this one. No, any doctor can do this one. Any endocrinologist can do this one. So you are not important, and Lisa is not important. The patient is important. Whether Lisa takes the case, or Musa takes the case, or some other Lena takes the case, or some other John takes the case, that is not our problem. Priya Sharma has to be treated, that's all. If not Lisa, some other fellow. If not you, some other person. Treatment is important. Patient is important, not the person who is treating. That's the point there. Subject means what? Regarding subject. So this is prima facie. Prima facie means the most important point, most important person. Now, what do you mean by prima facie? I'm talking all language terms. At first sight, what seems to be the truth when first seen or heard? You think that you are great here. I am referring. I am thanking you. That means I is important here. The first and foremost picture you have given, that you are writing about yourself. Okay. And you are treating the other person as a great person. No. At first sight, what is important? What is important? That is. Okay. It is formal. It is specialized. Ordinary people cannot use it. You are using informal style. Why you are bringing yourself? It's not in a proper official form. It is like you are writing a letter to your friend or somebody else. I personalized a letter. I want to tell you, I will tell you about my trip to Kashmir. I will tell you about my trip to Kabul or Afghanistan or USA or Canada. You are writing as if you are writing a letter. I want to tell you about a story. I want to tell you about my family. I want to tell you about my lunch or supper or dinner. Why I want you? Why I? Why you? It is informal. It is ordinary. It is not formal. It is not informal style and specialized. You have to show what is at first sight, which is important, the actual truth, based on what seems to be truth when first seen or heard. That should be. Here, you are giving importance to yourself, I, and you are giving importance, second importance to you, that means Miss Lisa Smith, and third importance you are giving to Miss Priya Sharma. How dare you? Okay. You are doing your duty, he is doing his duty. You are not doing anything great here. It is your responsibility, it is your obligation. You are paid for that. So avoid personalization of letters. Now I will tell you, I will give you those points. Avoid. These are very important points. Take them very seriously. Underline, highlight, mark, and do whatever you want. But this is very, very important. Avoid passive voice. Avoid active voice. Sorry. Avoid active voice. Okay. I thank you. It's active voice. Number one, mistake number one. You are using active voice when you are saying I thank you. I, subject, thank you. You are being thanked. Passive voice. At least you should have written passive voice. Passive voice is requested, a demand of OET. Passive voice is demand of the OET. Yeah, Dr. Imrah Rashid Kirmani. Unmute, please.
Yes,
are
sir.
you ready to take the hammer stroke? I want you to transform into diamond. Are you ready to take the hammer strokes?
Yes, I would.
Yeah, I take your consent first, and then afterwards, don't tell, sir, you are teaching too much, you should not tell. That's why before.
No, right. Yes, I appreciate this.
Yeah, you have paid so much for only writing, you understand? That's it.
Yes.
You are paid so much, so you have to get quality. Okay, that's it. Okay, I'm muting you back. So what you have done is, I thank you is active voice. Okay, you are thanked by me. You are thanked. That is passive voice. So actually, I is not. So avoid personal pronouns. Why are you using personal pronouns? I, you, he, she, it, they. Avoid personal pronouns. Next one, avoid repetition of words. When you are using this I, when you are using this you, these personal pronouns will be coming again and again here or there. She, I, you. See, her, she, they will come. So these personal pronouns, okay, in view of the above, it would be appreciated if you could. See, you came again. In case of any queries, please do not ask. So sometimes you can use, but not always. So avoid these personal pronouns. Third one, avoid repetition. Avoid commonplace words. Okay. And the fifth point is avoid ordinary styles. You should be something special. So all these things, avoid ordinary things. What everyone does, don't do that. Because you are not some Tom, Dick, and Harry. You are Simon Says student. Remember that. Okay. Now, so thank you for seeing Mrs. Priya Sharma. Directly, you can start with Mrs. Priya Sharma, who has type 2 diabetes with elevated blood sugar levels. Okay. So, Mrs. Priya Sharma, who has type 2 diabetes with elevated blood sugar level, comma, is being referred for further management. You could have written like that, simple. Okay, that's finished. So your sentences are correct, no doubt. Thank you for seeing Mrs. Priya Sharma, who has type 2 diabetes with elevated blood sugar levels. Full stop. That is correct. Here you should have put a full stop. She is being referred for further management. Another sentence, that's fine. But this sentence is not fine. Okay, next one. Mrs. Sharma has a family history. Yesterday I told you a family history, a family history. You forgot that. You took it from 1 year and you left from another year. It did not stay in your brain in between. So hold it tight now. Same mistake you should not do again. Mrs. Sharma has a family history of type 2 diabetes. And she was diagnosed with the type 2 diabetes. She was diagnosed with the type 2 diabetes. Okay. In 1998. Fine. So, initially, on 29 December 2018, so you can bring this forward. On 29 December 2018, comma, here there should be comma. Here there should be comma. So initially will be removed from here. On 29 December 2018, Mrs. Sharma initially visited the clinic or initially came to the clinic. She did not come to the clinic. She visited your clinic. It's a visit. Okay. It's a visit. Right? Use some special word. Initially visited the clinic. Okay. And expressed her concerns. Okay. On 29 December 2018, you can write in your notes. I cannot type everything. On 29 December 2018, during the initial visit, no need to say Mrs. Sharma again and again and again. Only one subject is there. Mrs. Priya Sharma will not become Mrs. Margaret Thatcher or Mrs. Jasmine Flora or Mrs. some other something. No, it's not changed. It's only one. Why do you want to say Mrs. Sharma? Do you think I forget that it's Mrs. Sharma? Even if you say she, I can remember here subject. Okay, she means Priya Sharma. That's enough. Why do you want to take the name of Mrs. Sharma again and again? I don't think there is any need for that. On 29 December 2018, during the initial visit, concerns regarding clinic only. She will come to your clinic only. We know that one very clearly. During the initial visit to the clinic, you can write if you want. Concerns regarding blood sugar levels have been expressed, have been reported, have been informed. So like that you can write there. So on 29 December 2018, during the initial visit to the clinic, concerns regarding the why her concerns regarding blood sugar levels or the blood sugar levels, concerns regarding blood sugar levels were informed, were reported, were expressed. Okay. Okay. Next one. Which were not getting controlled. Controlled spelling, double L. Controlled spelling, double L. You lost 3 points here. Spelling mistake. Despite treatment. Okay. Right. Concerns regarding blood sugar levels were expressed. Concerns regarding blood sugar levels which were uncontrolled despite treatment were expressed. Like that you can say. Okay. Her physical examination. Why her physical examination? You have only one patient. You will not do physical examination for him or me or you or somebody else. Only one person is there. Why do you want to say her again? Unnecessary. It is not necessary. The physical examination was unremarkable, except, my goodness, what is the spelling of except? So another 3 marks you lost. Controlled, then except, EXCEPT, you wrote ECPT. Okay. Aks means in Arabic or Urdu you say aks means reverse order. Instead of CE, you wrote EC. You wrote the other way around. Okay. You misplaced the letters. Unremarkable, except for blood pressure. Except for blood pressure. Okay. Which was 155 by 100. I don't know what you have written here. It's not very clear. Okay. Therefore, candiceptan is candestron or candiceptan? Okay, let us see the case notes. Yes, candicertan or atacand. Candicertan is the generic name and atacand is the brand name. Okay, candicertan is the generic name. See, small letter. Atacand is the brand name. Why don't you use atacand brand name? Because candicertan is a generic name. You did not give any brand of candicertan. You gave a specific brand that is called atacand. So you could have written that specific. No, if I call you doctor, that won't be fine because I know you by name and you are my friend. I need not call you doctor every time. I can call you Mr. Imrah, finished. Imran, finished. Okay. So when I know you by name, I will call you by name. If I don't know your name, then I will call you doctor. If I'm an ordinary person and I'm coming to you for treatment, then I know that you are a doctor, so I'll call you doctor because I don't know your name. But when I know your name, I'll call Mr. Imran. That's it. Why should I call you by the name doctor? Because I'm not your patient. So that's the difference. No? When you know the brand name, special name, you have to call it by its special name. For example, you call a small boy, hey boy, come here. No, my name is Ibrahim. Call me Ibrahim, don't call me boy. He will tell like that. So when you have a special name, use it. And A capital letter, candicertan. Why did you put capital letter for candicertan? So here two mistakes you have done. One is you have used the generic name when there is a brand name, and you used a capital letter for generic name. Only for brand names you have to use capital letter. 4 mg once every morning was prescribed. Very good. On 5th January 2019, comma, before no space, after there should be space. Here no space, after there should be space. Why did you put same space both the sides? Here, how much space you put this side? How much? No, you are not supposed to do like that one. And L, don't put this round around L. Let it be straight. Nah? Okay. See, this is very fine looking, but here you see something like a maybe P or something like that. Okay, why are this going and touching the above line? You're not supposed to touch the above line. That's the rule. See, your O is touching. Why? 3/4. You have to stop it here itself. It should not touch the line. You have to stop 3/4. Small letter will be half the height. Capital letters will be 3/4 the height. That's the rule. So you don't know the rule. Why is it going above? Okay, control those heights. Then on 5th January 2019, keep the space between 5 and January. Lab reports. You can say laboratory reports. Why only lab reports? Why don't you use the full form? Lab is the short form. Laboratory is the full form. Use the full form. No? Laboratory reports showed. You can use the best word, revealed. It's correct only. I'm not telling it is wrong. It's correct. But quality, improve your quality. Laboratory reports revealed elevated cholesterol. Now, elevated. Do you think that I don't remember you already used the word elevated here? You already used the word here. And why you are using the same word here, elevated? This word is repeated. Avoid repetition. Avoid repetition of words. Why are you repeating the words? Okay. Cholesterol and HbA1c level. So cholesterol level is different and HbA, this level is different. So levels. Okay. Okay. And this 10% you told, 10% which, both of them or only this one? So you have to show some difference. Okay. Cholesterol and here you can see this 10% is for cholesterol or for HB. Okay, you have to be very clear there. Then if you are saying level here, this level is for both cholesterol and HB. So it should be levels. Okay. Levels. Hence, metformin dose was increased from 500 mg to 750 mg. So mg is not necessary here now. 500 to 750 mg. That's understood. Why repetition? Twice a day, twice a daily. Instead of a day, you can say twice daily. It's correct only. It's not mistake. But you could have saved one word, a day. So daily. In addition, comma, glipizide 5 mg, 2 tablets every morning was prescribed. Blood pressure and cholesterol had improved. Why had improved? Why had improved? Improved is enough, na? Why you are using past perfect? You cannot use past perfect here. Improved, that's all. And significantly, on her next reviews. Next reviews only improved. Improved gradually. Okay. Improved gradually. Okay. Blood pressure and cholesterol improvement. Significant improvement in blood pressure and cholesterol levels were observed during the next reviews, following reviews. Okay. So, significant improvement in the blood pressure and cholesterol levels were observed during the next. They did not improve on the next reviews. On the next, they were already improving and you observed during the next reviews. They did not improve. So what do you mean? When you conducted the new reviews, they improved? Huh? No. Your reviews have no role on the improvement. They improved and you found that in next reviews. That is the point. Unmute Mr. Imrah. I want you to tell me whether you understood my point or not.
Yeah, I got it. That means
because you were reviewing, they did not improve. They improved and you reviewed and you noticed that improvement. You understand?
Yeah.
Okay. From this sentence, we understand that when you did the reviews, they improved. That doesn't happen. You are not a magician. You are not a god. Okay.
So how we can write a significant improvement
so that is what
in
I'm
blood
going to
pressure?
say. You got it clear?
Yeah, I understand.
Okay, now you can mute back. I'm writing the sentence for you. Okay. Significant improvement of blood pressure and cholesterol levels have been noticed during the following reviews or visits. Okay, is that clear now? Yeah. So significant improvement. When you are taking the picture, take it very neatly, put it straight so that when I type something, it will be easy for you. And it will be clearly, otherwise lines are coming in between. Take a neat picture with the line straight and everything. Use Microsoft Lens and take a good quality picture. Okay, significant improvement, okay, of blood pressure and cholesterol levels have been, significant improvement has been noticed. Okay, significant improvement has been noticed in the blood pressure and cholesterol levels during the call. Like that also you can say, this has been noticed. You can take it here also. Right. Has been noticed in the case of blood pressure and cholesterol levels. Yeah. So, however you want to write, you can change and write. Then today, her pathological report showed. See, again, you are using the same words, showed. Did you not use the word showed here? So why are you repeating the words? I can identify. Then you think they don't identify. They only correct the letters. They will easily identify. They will fry you and roast you. Okay. Today, her. Why her? Say, today, the pathological report revealed fasting sugar of 60 and non-fasting hyphen. Sugar level was of, you can write here also of, then here also of. No, why was? So same style you use. In view of the above, it would be appreciated. What is the spelling of up? You lost 10 marks. Third mistake spelling. Appreciated spelling. Again the same mistake. A-P-P-R-E. You wrote E-R. This is language influence. This is language influence. Okay, appreciated. A-P-P-R-E, you wrote E-R. Okay, then again here. See, unnecessarily you put E here. A-P-P-R-E-C-I-A-T-E-D. So be careful. Then next one. It would be appreciated if you could provide further. Why is this line cut off? Take proper picture. Nah? See, I don't know what you have written here. If you could provide further assessment and management of Mrs. Sharma. Fine. In case of any queries, please do not hesitate to contact me. Yours sincerely, Doctor. If you could provide further assessment and management, I don't know whether you have written correct spelling or not, of Mrs. Sharma. Okay. So this is how it is. Present, please take the full page picture. Why this half page is cut off? Why you want to cut off? Let it be there, na? See, unnecessarily it got cut off. Take neatly and take clearly. Okay. Yes, Dr. Imrah, unmute, please.
Yes, sir.
Yeah, is that clear for you?
Yeah, it's clear.
If you want, you can go to the video, YouTube video. I have put it on the YouTube. So you can collect it for there, read there again, listen again, stop, write whatever you want and make improvements and rewrite and keep it. Okay?
Yeah, okay, thank you.
Okay, fine. Are you happy with the feedback today?
Yeah, very nice, very nice.
Maybe you are getting upset because I'm treating you
No,
like a small child.
not at all. I don't want to get upset and I want to get good marks in exam. I'm not
That's
upset.
it.
Why should I?
That's it.
Yeah.
Today, even if you're upset, control, no problem, because tomorrow you will dance, okay?
Yeah.
With happiness.
Yeah, inshallah.
Right. Unless and until the hammer stroke are received by the crude diamond, the diamond cannot be transformed into a glittering, priceless diamond,
No,
which can be adorned by kings and princes, okay?
The spelling mistake is not the influence of my, the language, but the thing is, maybe I was not concentrated more on duty. That's why I made this spelling mistake. Otherwise,
No
this is not
problem. That's quite common, no problem. So that is why you are coming to me, na? It's my responsibility now, right?
Yes, I got it.
You are in the making. You are not made, okay? You are in the making.
But one thing, one I want to tell you this one. I wanted to say elevated cholesterol levels only, and then HB1. I'm telling separate. That's elevated cholesterol and HbA1c level of 100. So this is elevated was the cholesterol, but the level of HB1AC was 10%. That I wanted to.
Okay, then what you wanted to show is fasting sugar. What? Fasting sugar what?
No, not this one. Not this one. This one on examination. This one on 5th January. That one.
Okay, on 5th January. Okay, let me see. Yeah, on 5th January, lab showed elevated cholesterol and
elevated is cholesterol. But HB1C level is 10%. That I wanted to. This is the separate thing.
Yeah,
How
you
much
have
is-
to show that difference. Okay.
Yeah, yeah.
Next time, be careful. It's okay. It's okay. This is the beginning. Okay.
Mhm.
Okay. Good night, sir. Dinner
Good night.
time.
Good night. Thank you. Thank you.
Okay.